Hi, I'm Barry Milne. I'm a research fellow at the Centre of Methods and Policy Application of Social Sciences at the University of Auckland. And I'm going to take you through a presentation today about a project we're working on called Modelling the Early Life course, which we abbreviate to MLC. It's a project that's funded by the New Zealand Ministry of Science and Innovation, and the various people in our unit work on it, including Peter Davis, who's the director of the centre, Roy Lei Yee, who's a research fellow, Jessica Thomas and Janet Pearson, who are statisticians, and Oliver Mannion, who's developed the tool. Okay, so the first thing I'm going to talk about are the goals of the MLC project, a little bit about what microsimulation is, and also talk a little bit about how we've involved policy reference group, policy end users as we call them, who've helped immensely in the development of the project. I'll then take you through a demonstration of the tool. We've developed some software that houses this microsimulation model, so I'll take you through that. And then I'll finish off with where we're going next with this. As I mentioned before, Modelling the Early Life course MLC is a research project funded by the Ministry of Science and Innovation. It's a 5-year project. We're nearly 4 years through that project, so we've got a year to run. And what we're trying to do is develop a software application as a decision support tool for policymakers. So the idea is we'll develop this piece of software that will model the early life course of children, and it'll sit on the desktops of policymakers and they can interrogate it. So they can ask what-if questions. What if the rates of smoking in pregnancy were different? How would that affect child outcomes, for instance? And by doing this, we hope to improve the policymakers' ability to respond to the issues concerning children and young people. And how we're doing this is by building a computer microsimulation model. By microsimulation, I mean a simulation of micro-level data. In our case, that's individual children. And for these to work, what you need is a base sample and some rules that transition people through the life course. And for those, we're using existing New Zealand longitudinal studies. Just to develop that a little bit further, I said you need a base sample and you need rules to transition people through the life course. For the base sample, you could use either a real sample or something that you've made up. And what we have done, in the initial phases at least, and we're still on that phase, is used a birth cohort of children from one longitudinal study. That's the Christchurch Health and Development Study, or the CHDS. And this is a sample of 1,265 children born in Christchurch on the South Island of New Zealand in 1977. We are, however, at the moment looking to develop a slightly more representative sample. That's a sample that's representative of the current population of New Zealand. And this will be a synthetic sample insofar as we'll analyse New Zealand census data from 2006 to form a cohort that has characteristics of New Zealand children but doesn't represent any real New Zealand children. But for the moment, the cohort we're using as the base sample is the Christchurch Health and Development Study cohort. What you then need is, as I say, is rules to transition people through the life course. And you can get these rules from wherever you like. We've got the rules from analysing longitudinal data. Again, at the moment, just focused on the Christchurch Health and Development Study data. What we are doing, however, is gathering together data from other New Zealand longitudinal studies and combining those to analyse them together, and we hope that will give us slightly more representative estimates of transitions from one point to the next. And what you end up with then is when you start with a sample of children and transition them through the life course, you have this virtual cohort, in our case from ages 0 to age 13. And then you can simulate what might happen if policy were to change. So you can change some features in children's lives, either at the start, at birth, or any part of their lives through from ages 1 to 13, and see how that affects outcomes of interest. So this slide gives you a bit of an idea of what our model contains. If you look at the right-hand side, we've got the 3 outcomes that we've focused on, they being health service use, education in terms of early literacy, reading ability, and social justice outcomes, that's conduct disorder. And all of these may be affected by various things, either at the structural level, we've got some child characteristics there, their gender, ethnicity, the parent characteristics and some family characteristics about the socioeconomic conditions that the child grew up in, which may impact various intermediate level characteristics, say about the parent's employment or their material circumstances or various psychosocial factors, which may then in turn impact on the outcomes that we're interested in. In terms of the simulation, the arrows indicate what needs to be simulated before something else is simulated. So we start with structural level characteristics, which are at the base level and aren't simulated at all. They then impact on these intermediate level characteristics, which are simulated. So every time you do a simulation run, and you can do as many as you like, we tend to do 10 to 20. So each time you do a simulation run, you end up with a slightly different value, and these different values then impact on other things down the track, such as psychosocial characteristics and on the final outcomes of health service use, education, and social justice outcomes. And as I mentioned, this microsimulation model can be used to test what-if scenarios. So as the example I used earlier was, what if the rates of smoking and pregnancy were different? How would that affect outcomes down the track? And this is supposed to simulate the impact of a policy change, so policymakers can use this tool to test particular policies that they're interested in and see the outcomes of those policies. And this is why we've involved various end users or a policy reference group to help us with this. And what we've done is we've engaged people from different government agencies, and I'll take you through next what those agencies are. And we've more or less adopted a partnership approach with them, such that we meet with them regularly and we tell them what we've been doing on this microsimulation modelling tool, and they give us some advice on what we've done and on the direction we need to take it to next. And this has been a very, very useful process. And I mean, the whole idea of it really is to use the expertise to basically get a better model, because the tool is for them. It's a tool for policy makers, so it's only right that we involve them from the start. And it has, as I mentioned, helped immensely, and we have got better, I think, better policy relevant scenarios because of it. Okay, so our policy end users group comprises 2 representatives each from 4 New Zealand government ministries: the Ministry of Social Development, the Ministry of Health, the Ministry of Education, and the Ministry of Justice. So how this has worked with the end user group is we've gone to meet them every 2 months or so, reported what we'd done over the previous 2 months, and asked their advice on where to go to next. So you'll see at the first meeting that I was involved with, which was in May 2011 at the Ministry of Social Development, we talked about important scenarios that they would like us to test, and they came up with 6 or 8 of those. Then we went on to discuss various other things. In the next 2 meetings after that, we talked about some simulations being running in the first instance on health services, and then in the next meeting after that about scenarios looking at conduct and education outcomes. Then we looked at, because we had been focusing at that point on, you run a scenario and what's the impact on the mean level of a certain outcome. They suggested that it might be more interesting to look across the whole distribution, because we were seeing relatively small effects at the mean level, and they suggested these might mask larger effects at one end or other of the distribution. We talked a little bit about the validation of the tool at the next meeting, and then the meeting after that in April 2012. We had started to have wider discussions about how the tool might be used and how it would be deployed on the desktop of policymakers, who would use it, and registration process for users and that sort of thing, and what caveats we have to put around use and little warnings and those sorts of things. And in the most recent meeting, August 2012, about a month ago, we started to have this discussion about, given that we're coming up to the last year of the project, as I mentioned earlier, what we have left to do and how we'll go about doing that. I'll move on now to showing a demonstration of the tool. And what I'll demonstrate is modelling the effect of various inputs on one outcome, that outcome being reading, for the child across ages 8 to 13. So I'll show how you can interrogate the system to check rates, that's frequencies and means, for various inputs and outputs that you might be interested in. I'll show you how you can go about changing inputs, and you change inputs when you want to run a scenario to see the effect of that input. So I'll show you how you can change various inputs, and depending on the type of input you want to change, how the different ways you go about doing that. And then I'll show the effect of changing various inputs on the output of interest, in this case, which is reading. So the first thing that will happen when you turn on the tool is it will run a base scenario. That's a scenario where you haven't made any changes to any inputs. So it's the, if you like, the natural course of a child's life without any intervention happening in the children's lives. And you can see on the left-hand side of the screen there, you may have to look closely, but it's got a list of all the frequencies and means for various inputs and outputs you might be interested in. And so what I can do, for instance, is look at the mean reading scores for children. So you'll see there at the top left of the screen, we've got the reading scores across ages 8 to 13 for children. You can see that this is the BERT reading score, where they have to read as many words as they can correctly in 45 seconds, and that number represents the number that they got correct. As you can see, we've simulated it such that reading is getting better across years, as you would expect. And as well as just looking at the overall reading score, you can also break it down by a few things. So the next two panels to the right of that, I've broken it down by socioeconomic status, splitting the sample into 3 groups based on the occupations held by their parents, that is professionals, clerical occupations and semi-skilled occupations. And also broken down by ethnicity. So we've got 3 major New Zealand ethnicities in the next panel: New Zealand, European, Pacific and Māori. And if you look at the bottom panel there, what you can see is across years 8 to 13, the distribution of the scores at the 20th percentile mark. So I've got the minimum 20th, 40th, 60th, 80th percentile, and the maximum score across each of those 8 to 13 years. So what you've done now is you have looked at an outcome of interest, reading, and now you're considering what would happen if I change a few things. So what's shown in this panel here is, on the left hand side I've got a scenario weightings panel, and you can click on any one of the items in there and change either the means or frequencies or values for that particular input of interest. So I've selected birth weight there. And birth weight exists as a continuous variable in the background, but for the ease of changing it, we've broken it up into 5 categories. So you've got your low birth weight category there, up to 2.5 kilograms, and then every 500 grams up to 4 kilograms and 4 kilograms and above. And you can see the distribution people in that group. What I then can do is, for each of those groups, I can decide to increase the birth weight for everyone in that group, increase or decrease the birth weight for everyone in that group, either by a certain amount. So here I've chosen to increase everyone in the low birth weight group by 350 grams. So if I do that, and then I hit update, you can see that the rate in the low birth weight group has dropped from 4.7% down to 1.9%. Various other things I can change. Socioeconomic status at birth, as I showed you there before, it's broken up into 3 categories: professional, clerical and semi-skilled. The rates there are around 21%, 53% and 26%. I can decide if I wish to change that to something else. So I've decided here to change it to 35%, 50% and 15%. And I hit update and then it makes that change. Okay, here's another example of how I can change a particular variable. The 2 I've showed you so far are time invariant and they're at birth variables. Here we've got a time variant variable, just focusing on the first 5 years for the time being. We've got whether or not children were in a 2-parent or single-parent household. You can see there it ranges from 7% in year 1 up to 10% in year 5. And then what I can do is I can change each and any year I want to change in terms of what my policy may impact in terms of single parenting. So what I've shown here is I've want to change the rates of single parenting across those years to be 2, 3, 4, 5 and 6%. I could have done it differently. I could have just picked 1 year and say, well, okay, in year 1 I want to change it to 2%, and that would be fine. And what would happen there is the simulation would take over and would simulate values for years 2, 3, 4 and 5. The way I've done it, however, is I've specified that for each of those 5 years the single parenting rate will be a certain amount, 2, 3, 4, 5 and 6. So I've made various changes now, and now what I can go and do is see what the effect on the outcome of interest, in this case reading, is. So on this panel here I've showed the mean reading scores for ages 8 through 13 overall and by ethnicity there. And then in this panel there, what I've done is I've run a scenario. Now the scenario I have run is not the one I just showed you, where I changed birth weight and socioeconomic status and single parenting. This one is a slightly more dramatic one, where I think socioeconomic status was changed, but I've also changed things like dependence on welfare, parental education, the warmth shown by the mother, and what this particular scenario does, if you look at the BERT reading score kind of middle top there, you can see in each of the years the reading scores have gone up by about 6 or so points, and that represents approximately a 0.4 of a standard deviation change. Going further to right, you can see that the impact is greater on lower percentiles than higher percentiles. That's partly a ceiling effect, I think. And you can also see, if you look at the panel on the middle left, we've got the base scenario for the three ethnic groups: New Zealand, European, Pacific and Māori. And down below that we've got the means and also the lower and upper confidence intervals, because we ran a number of scenarios here for New Zealand, European, Māori and Pacific after the scenario was run. So you can see that New Zealand, European and Māori both increased their reading scores by about 30 points, but there was a far greater change for Pacific children, around just under 90 points. Okay, so that gives you a little bit of flavour of what you can do with the Modelling the Early Life course tool, where you can change various inputs that you're interested in or may relate to a policy that you want to test, and see the impact on various outputs. And the one output I showed was reading. Over the next few slides, what I'm going to talk about is where we want to go next with this project. As I mentioned earlier, at the moment the model is based on using a base file from the Christchurch Health and Development Study and using transition probabilities, that is how people transition through life, derived from analysing the Christchurch Health and Development Study. We want to break free of that in both respects. In terms of the transition probabilities, what we'd like to do is combine together 4 different New Zealand longitudinal studies. That is, as well as the Christchurch study, we want to add in data from the Dunedin Multidisciplinary Health and Development Study, which is another study of children born in the 1970s, again in the South Island, this time Dunedin. The Pacific Islands Families Study, which is a study of Pacific Islands children. They were born around 2002, so far more recent. And also a study of Māori families called the Tihoi Nukuroa study, and that began in the late 1990s. And where we can, what we want to do is combine all these data together and analyse the integrated data sets and use those beta estimates as our transition probabilities in the microsimulation model. Where that's not possible, we will analyse the data separately and combine them in a meta-analytic framework. And as I mentioned earlier, you can get the rules for the transition probabilities from wherever you like. So there is a possibility that we can get estimates from various published studies where we don't have good data from the New Zealand longitudinal studies. And another thing that we'd like to do is extend the range of outcomes that we want to look at. So we have at the moment looked at reading and conduct problems and health service use. We'd like to extend that to various other health and well-being outcomes, and also extend the period of the life course that we cover. So I've showed you from 0 to 13. We want to extend that a bit further up to years 18 or perhaps longer, and of course for this we'll need a bit of funding, but hopefully that comes through and we can do that. Okay, and the other way we'd like to break free of Christchurch is by using a base file that is more representative of the current New Zealand population of children. And how we wish to do that is by analysing census data to produce a synthetic base file. That is, what we'll do is we'll derive a birth cohort from the New Zealand census, that is a cohort of 0-year-olds, containing birth variables relevant to our microsimulation, predict each of these variables from every other variable in there, and assign a predicted score for each variable. Then we'll stochastically assign synthetic values based on these predicted scores. And at that stage what you've got is synthetic data, and that synthetic data should faithfully represent both the distributions and the interrelations of the real data without matching any of the characteristics of any real individual. So it's representative, but it's synthetic. We're not using real data, and the advantage of that then is that should we need to pass it on to anyone, we can. We're not breaking any confidentiality rules by doing so. Also, various things we'd like to do in terms of tool development. All the scenarios that we're able to do at the moment, and what I showed you earlier, are scenarios where you do the same thing to the entire population. Policymakers have pointed out that it would be more interesting to do subgroup scenarios, that is, where you target a particular proportion of the population based on some characteristic, which might be ethnicity, socioeconomic status, or something else, and just run a scenario on that group. And they suggest that that mimics what goes on in the policy world a bit better. Also, we can run more than one scenario at the moment. We can run up to 3, I think, and compare the results of those 3. But it'd be nice if we could increase that number, and it's a devices issue actually with the R software at the moment that's stopping us doing that. So we want to work around that. Also, it's been pointed out that it would be nice to be able to, rather than just point and click to set up a scenario as I showed you, but to write a macro that will allow you to run a scenario or a range of scenarios, and then you can set the mousey tool running, and even if it takes a long time overnight or whatever, you can come back to it and you'll get a result. Also, it'd be nice if we had slightly better graphics to represent the base scenario differences, so you can see here, particularly divergences over time if you run a particular policy scenario. Okay, and just finally, other things we'd like to work on is more validation. I haven't showed you any to date, but we have done some validation on the models to date, and it validates some things well and other things not so well. The reading and the conic disorder outcomes validate fairly well, not so the health services outcomes, and that could say something about the pattern of health service use changing over the last 30 years in New Zealand. So how we want to do this, and how we have done the previous validations, is compare results against other data sets that contain the same outcomes or national rates of certain things. And we should be, especially once we get the representative base file in there, we should be hitting national rates of all the things that we're interested in. What that does, that validates, if you like, the base scenarios. You also need to validate the policy scenarios. That is, validate that if you do make a change of X magnitude to a certain variable, that you actually will see that change. And this is a bit more difficult. But what we might be able to do is compare our results to intervention results where there's been a published intervention study to see that, okay, if we did make this change to this particular variable and we showed this size of effect, then then there's a published paper out there that also says you get this size of effect. It gives us a bit of confidence in our results. The end product here, as I say, is a policy tool that's on the desks of policymakers. So we've had discussions recently about how we're going to deploy this. And we've decided that we'll make this available. There was a discussion about whether we'd keep it in-house and people could ring us up and say, would you like to simulate this for us, please? Or we put it on the desktops of policymakers. We decided on the latter. And there'll be a few hoops people have to jump through, though. There'll be a registration process with training on how to use a tool before people can use it. The caveats and pitfalls of the tool will be made explicit, and there'll need to be user support available. We'd need to be contactable if people don't understand something that's going on with the tool. We're thinking of this as a web-based tool, but in many respects it's slightly easier to set up as a remote desktop access. It makes it easier. Also makes it easier for us to make adjustments to it in the background. So I think that's probably the way it will go. And as part of the process, it's become apparent that what might happen, again, funding would be needed for this to carry on further. But that if we've got a whole bunch of users out there who are using this and feeding back to us, then they can essentially help the future tool development. They can point out where things are working well in their view and where things are not working so well in their view. So that might be quite a good development if once we get it deployed and we've got users using it, they can actually help us with the future development of it.